All right, I see we have some attendees still coming in. I'll give it just a moment before we introduce today's webinar. Thank you all for being here. Oh, great, thank you. So I am Dr. Natasha D. Jarnett, Interim Associate Director of Program and Partnership Development at the National Environmental Health Association. I am pleased to welcome you to the 8th installment of NEHA's live chat series, COVID-19 Essential Functions of the Environmental Health Workforce. Thank you for joining us today. The live chat series highlights the role of the environmental health workforce in reopening, recovery, and resilience of the environmental public health system during the COVID-19 pandemic. In addition, the series explores challenges posed by the pandemic on environmental health and the plans to address these challenges going forward. Before we get into the details of today's live chat, I would like to highlight an important COVID-19 resource that NEHA will soon release. NEHA's second COVID-19 needs assessment results will be released in early October and will be available on the emergency-neha.org webpage. Also, on NEHA's COVID webpage, you'll find our latest resources on COVID, including the first report of the Rapid Needs Assessment, NEHA's position statement on COVID, the Just-in-Time video series, and the Heroes in a Time of COVID blog series. We strongly encourage our viewers to become NEHA members since membership in our organization offers tremendous value. Please visit neha.org/join for further information. Please note, this live chat is being recorded. The recording will be made available as soon as possible and shared on NEHA's website. Now, on to today's live chat, COVID-19 and climate change, concurrent health emergencies. Without further delay, I will introduce our esteemed guest speakers. Surili Sataria Patel drives strategic development to bridge the gap between public health programs and sound policies. She wears multiple hats at the American Public Health Association. As director of the Center for Climate Health and Equity, she works to inspire action and advance policy that addresses climate change at the nexus of health equity. As Deputy Director for the Center for Public Health Policy, Ms. Patel leads the organization's most notable environmental health programs, including water safety and security, children's environmental health, tribal public and environmental health messaging, transportation and health, and healthy community design. She applies her role in both centers to champion diversity and advance health equity and environmental justice while promoting public health solutions. And as an added note, having the opportunity to interview Ms. Patel is particularly exciting for me because she's my former boss. I'm honored to have this opportunity to sit down with her and glean from her expertise and in support of the environmental health workforce in this time of COVID. So, as you listen to our dialogue today, we will have time for question and answer at the end. So please send any questions that you have through the Q&A feature. If you have any concerns about technology or you're having challenges hearing us, please use the chat feature to communicate that. So Surili, we're in the midst of concurrent health emergencies. The death toll of the COVID-19 pandemic has exceeded 200,000 individuals here in the US. Climate change has also been declared the greatest global threat to public health, as acknowledged by both of our organizations. And we're in the midst of a racial reckoning. On the surface, these may seem like independent health threats, but we're experiencing them concurrently, and they are related. So Surili, just to orient everyone to our conversation, could you please discuss how COVID and climate change are linked and how COVID safeguards can promote a healthier climate?
Absolutely. Hi. First of all, thank you so much for having me today to talk about the intersectionality of climate and COVID. Wow, what a big topic. Let's start with a common understanding of climate change that we talk about as a threat multiplier. And in recognizing that, we recognize that the same practices that have led us to rapidly changing climate, like deforestation, Urban crowding, our agricultural and livestock practices, and so many more have enabled environments where new and re-emerging infectious diseases can thrive. So there are a few areas that I'll just touch on right now. And I think the one that everyone has top of mind right now is air quality, because of the wildfire smoke that so many people are experiencing. We know that exposure to PM 2.5 can affect lung function and has worsened medical conditions such as asthma and heart disease. We also know PM 2.5 has been associated with preterm birth and low birth weight. There's also a recent study published by Harvard that links air pollution to higher rates of death due to COVID. So people with COVID who live in the US and regions with high levels of air pollution are more likely to die from disease than people who live in less polluted areas. So big intersection there. The next one is flooding. I mean, the next climate related disaster that's top of mind and something that we're running out of names to call it this year are hurricanes. But I want to focus more on the flooding side of things. In the US this year, in 2020, we have faced unprecedented threat that requires significant and collective action. A flood that hits during COVID-19, during a pandemic, has enormous health and economic fallouts. We need to focus on this dual disaster, is what I'm calling it, because in the US, we have 128 million Americans that are at risk of flooding. And a country that's already seen more hurricanes than normal this season, we also need to focus on what that means for COVID. So both of them compound existing health inequities, populations that are disproportionately experiencing social injustices concerning health, employment, and the environment. And the last thing I want to touch on, and there's many more consequences and intersectionalities of this, the last one I wanted to really touch on is mental health. We are in uncharted times. Some have lost the lives of their loved ones. Some have lost their livelihoods, their ability to pay for basic needs. Others are in a home that has undesired housing qualities, or some are facing some form of abuse. Some may have food or energy shortages. These are real times. Mental health has risen to the top of almost every conversation I've been a part of since April. And in this area, as a nation, we need to invest into seeing changes that we need to help communities to protect themselves, not just from the immediate impacts of climate and mental health, but the gradual ones, like the chronic stress that we're experiencing right now, or the indirect impacts due to displacement or feeling disenfranchised from your community, having the sense of social cohesion and interaction. So there's a lot of intersectionality that we often don't think about, but when we're talking about a community or we're talking about individuals, we're seeing a lot of areas where COVID and climate are certainly intersecting in a very deep and frightening way.
Absolutely, very well stated. And it's certainly a deep and frightening way. And you laid out a case through that with air quality, how place matters, flooding, these dual or triple disasters. And then on top of that, the mental health burden. Very well said. So earlier this year, you and I, together with Joy Blackwood, co-authored an op-ed on COVID-19 early in the crisis, where we described the urgency for public health preparedness to have equity and justice at the center of action. Shortly after publishing that article, we began to see differences in the health outcomes being revealed for COVID-19. What strikes me about the COVID-19 pandemic is how it has laid bare health disparities here in the US. In fact, many of the populations that are most susceptible to COVID-19 also bear a heavier burden of climate change as well. Our colleague, Dr. Jalan White Newsom of the Cressy Foundation, is quoted as saying, across the US, climate change and COVID are playing out in tandem. The warming planet drives increasingly extreme weather, compounding the pandemic's impacts and complicating disaster response. At the same time, these dual threats have exposed profound inequities that divide and weaken us. So I have a few questions for you, Cirili. Could you please explain how these inequities that we're seeing uncovered by COVID, can you expand on those? And then also illuminate certain populations that are bearing a heavier burden to COVID and climate change. And then also, we'd love to know, how can the environmental health workforce address inequities when also addressing the pandemic and climate change?
I love this question. First of all, let me just pause and say the op-ed that we wrote at the beginning of the year, who would have thought we would have been where we are? I think the biggest challenge we thought at the top of 2020 was perhaps getting out the vote and finding a strong path forward for our country. But back to your question, I think unfortunately the populations that are least resilient to natural disasters are also the same ones being hardest hit by COVID, such as, let's see, children, low-income communities, people with disabilities, let's see, chronic illnesses, pregnant people, people of colors, indigenous people, and so many more. And I recognize that NPR recently uncovered that, let's see, African American deaths from COVID are nearly 2 times more than expected, right? And in 42 states, including and DC, Latinx make up a greater share of confirmed cases than their share of the population. And something that strikes me as most compelling is that in New Mexico, Native American communities have been accounted for 60% of COVID cases when only being 9% of the population. So there's a lot of disparities in terms of how COVID is ripping through our country. And so many of the same structural, racial, and health inequities that factor into COVID disparities also underpin the, some health effects that are also being seen by a changing climate. We see communities that are more susceptible to disease, have pre-existing health conditions, live in areas that don't promote good health or well-being, and many other social determinants of health, to name a few. Systemic racism, let's start right there. This can lead to chronic and toxic stress that shapes society and economic factors that put some people from racial and ethnic minority groups at risk for COVID. We also see a limited access to healthcare, and it could be access because of insurance. It could be access in terms of geospatial physical distancing to healthcare facilities. It could also become an access issue in terms of transportation. So many issues in terms of healthcare. And then there's housing. So redlining practices, I should say, in terms of real estate and mortgage industries that have pushed lower income communities to live in homes and neighborhoods that were physically deteriorating with poor property values and poor resiliency to storms. Those go hand in hand, those aren't separate. And these communities are more likely to live in urban areas with less green space that help reduce the heat. So growing and disproportionate unemployment for some racial and ethnic minority groups during COVID pandemic may also lead to greater risk of eviction and homelessness, overcrowding. And residents don't have access to air conditioning, are often then forced to go seek refuge in cooling centers when the guidelines are stay away from other people. So there's a lot to consider, and race being the #1 indicator for placement of toxic facilities in this country. Let's talk about that for a moment. Going back to air pollution, this makes air pollution an issue where low-income communities and people of color receive disproportionate share of toxic air releases. So as a nation that faces disaster after disaster, worsening disaster after worsening disaster, communities who are already experiencing heightened socioeconomic vulnerabilities to COVID, there's some key challenges. The first is limited resources. COVID has already overwhelmed the local emergency response resource. You all know this. You guys are on the front lines. NEHA members are definitely on the front lines. And leaving responders with limited workforce capacity, supplies, essential goods, such as food, water, medication, so much more. Families and people already dealing with unemployment or loss of income during natural disaster would further heighten their ability to stability and good health. And then the other key component to this is mixed messaging. Public safety announcements for natural disasters, such as calls to evacuate to shelters, contradict the messaging around COVID, which is stay away from crowding, keep indoor, stay away from indoor spaces. So it's really critical that we think through ways we can message this in ways that our communities can best receive it when we're asking them to do something that contradicts national leaders or other leaders. And so to be a little bit more specific to answer your question, because I love when we're talking about action, there's a few things that the EH workforce, I feel, can do, including address and improve the social determinants of health by naming them, call them out, identify them, and then work towards them. Anchor resilience in our communities by understanding who are the most vulnerable to not just climate change, but COVID, because sometimes they're both the same. And then we need to develop educational resources so we can better understand cultural sensitivities to when we're approaching, especially BIPOC communities. And of course, environmental health professionals could lend their voices. I think this is a huge value add to the climate conversation, but also COVID conversation, in that telling your story, whether it's your response or your own experience. APHA has a series called the Tiny Climate Chronicles, which we show you how to tell a story in 100 words to prove impact, to show and inspire others to take action, to be aware of climate change and health inequities. So check it out.
This is incredible. I'm taking notes furiously as you're sharing. There is so much to unpack here, but there's a lot of opportunity and direction for the environmental health workforce right at the nexus of all these concurrent emergencies. And I love how you rounded it out with telling our story. We have a story to tell. We have experiences in our communities where we're working locally or in our states, and are able to share that, or from our own personal experiences or how it affects us. And doing these in a culturally competent way, with cultural sensitivity. And I appreciate that you empowered us to name the social determinants of health, to be able to call out what's happening here. Thank you so much, Cirili. So to quote Dr. Ed Maybach, famed climate and health communicator of George Mason University, climate change is real, it's happening now, it's affecting health, and there is something that we can do about it. This year, we have had record-breaking heat in some areas. We are fighting deadly wildfires in the West as we speak. And this is all as we recover from hurricanes Laura, Sandy, and Beta. We expect a record-breaking number of named storms to make landfall this year here in the US. And each of these affect the health and safety of our communities across our nation. What's further challenging about climate change to me is that it can't just be paused so that we can address another concurrent health emergency, like in the case of mitigating this pandemic. So in NEHA's first COVID-19 needs assessment, and as I said, the second will be released early October, this needs assessment revealed that over 50% of the workforce was called into COVID-19 response activities as early as April of 2020. Our members work at all levels of government, uniformed services, and academia, but the overwhelming majority of NEHA members work in state and local health departments. So my question for you, Cirili, is given the many roles of the environmental health workforce in climate adaptation, what are some examples you're seeing of best practices that you can offer to the environmental health workforce that's mitigating the pandemic and engaging in climate and health adaptation in tandem?
Yeah, great question. I think it goes without saying that there are the most important things that we can do in terms of our line of defense against COVID, which are wash your hands properly and frequently, wear your mask, and keep physical distance from others. But there are certain circumstances COVID creates in which it's harder to follow these guidelines. And I should say the same thing goes for climate change. So at APHA, we're aiming to share resources that will help us think through the best ways to help communities from these co-occurring crises. We partnered with the American Flooding Coalition to point out some best practices that EH could face. in terms of COVID and flooding. And I think the link was in the chat, and it talks a little bit about examining existing emergency plans. It talks about focusing on vulnerable populations and anticipating risks and identifying possible responses, and then securing additional volunteers, food, medical supplies, and shelters. And then developing an emergency communications plan. So things that we kind of talked about previously, but just really specifically to flooding, I think that's really key because our standard of operations may need to be altered because of COVID. And then we point to oftentimes the CDC guidances. So the Centers for Disease Control have developed a number of documents that offer guidances on how to protect communities from climate-related disasters during COVID. So they have one on cooling centers. Physical distancing and air filtrations are some considerations that they offer while you're asking folks to come into cooling centers. Energy and energy affordability is such a huge issue that in a lot of communities, cooling centers is really the only reprieve for against climate change. And then they have another guidance that talks about what to do during a public disaster, how to shelter during pandemics. And this includes information on how to keep the spread of potential diseases low and how to protect children while in public shelter. Oftentimes we're hearing a lot around those who are experiencing homelessness or who have experienced homelessness talk about their children and how they can seek refuge in the time of COVID and climate. And some of the other compounding factors is being really, really hot in a city, experiencing homelessness, and you have a child, a minor, who's also menstruating. And how do you have access to a safe showering facility? Oftentimes there's legal issues around it. So there's a lot of work to be done in terms of what it means to shelter during a disaster. And then another resource I want to highlight from CDC is hurricane evacuation, specifically on how to evacuate or what to consider when you're staying with families and friends. And how to evacuate is a huge conversation, especially when we're talking about access to transportation. How do you ride share? How do you get out of a danger zone? And so these resources, I specifically called on these, and there's so many more, mostly because I think it's so important to recognize that this work that environmental health professionals are doing in both the COVID side, but also the climate side, can't be done on our own. We absolutely need to work in coalition. We need to work with the other spokes of a wheel that also are working towards protecting the health of communities against climate and or COVID. And so I would just say, there's a lot of intersectionality in terms of the sectors and the folks that are working on this. It's not just local elected officials, but it could be the local homeless shelters. It could be the Department of Energy. It could be agriculture. There's so many intersectionalities in terms of evacuating or sheltering or protecting against some of those climate threats that will aggravate COVID conditions.
Absolutely. There are so many factors that can aggravate this, and this really makes a strong case for the need for a well-rounded and knowledgeable environmental health workforce. So I have one more question that I would like to share with you, Cirili, and then I want to make sure our audience knows that question and answer is open and available to them. Please send any questions through the chat, and as you do that, I'll ask Cirili this last question. I have seen you speak on energy justice several times this year, and I've actually had the privilege to represent NEHA during APHA's roundtable on the topic. So, Cirili, can you please explain the concept of energy justice and what role environmental health can play? And also, what does energy justice mean in a time of COVID or for future pandemics?
So I can talk about this forever. Feel free to cut me off so we can hear questions from the viewers. But on the very basic level, energy justice is a principle that all people should have reliable, safe, affordable energy source, and the protection from disproportionate share of costs or negative impacts associated with the energy life cycle, if you will, from the extraction to the usage to the storage, the end. So in the same way that climate change disproportionately affects certain populations, energy has health equity issues as well. Over, I guess, the past 60 or so years, the environmental justice movement has raised awareness that people of color and low-income communities often bear the brunt of brown environmental issues. Meanwhile, white and more affluent communities are enjoying the benefit of green environmental benefits. In this context, energy and race, even class, is the #1 indicator for placement of toxic facilities in this country. We touched on that. Housing in general is one of the other best known and most, I guess, well documented social determinants of health. Affordability, location, quality, housing have all been independently linked back to health. So it's important to acknowledge that the effect that historical practices of redlining and discriminatory housing codes have instilled are still impacting our communities to achieve equitable energy. And then also, you know, going back to 2015, it was a study that 31% of US households reported hardships in paying their energy bills or maintaining adequate heating or cooling in their homes in the winter or summer times. So as a climate change situation in our specific communities worsen, alternative energies such as solar, wind, are often becoming more competitive. So they're becoming more affordable and accessible. So alongside community leaders, I think it's important to note that public health professionals have a strong role to play in monitoring, evaluating, supporting, and transitioning to a healthier green energy supply. And yes, there is a connection between COVID and energy justice. A recent study highlights that COVID has revealed pre-existing energy justice crises. So one is that not everyone in the US has equal access to utilities. We know this. The other is that essential services like electricity and water are treated as consumer goods, which isn't affordable by everybody. So let's be clear, energy is essential for us to meet our health needs. And COVID, many times, individuals have lost their jobs and have to stay home, leading to an increase of residual energy use. And in this situation, as energy usage goes up, many can't afford the costly utility bills because they lost their jobs or they've had to reduce their work hours. There's so many different reasons. And this has really affected vulnerable populations, or climate sensitive populations, I should say. In that, it's been reported that African Americans, 16% and 19% of Hispanic households are far more likely to report difficulty paying an energy bill than the white counterparts, which go at 9%. So there's a few tangible ways. Let's talk about what we could do, because I really like the action piece. And it's to strengthen community partnerships. Let's talk about meeting with underrepresented frontline tribes and communities that are protecting their land, which various energy interests see as available to them. Let's partner with social services or community action agencies to serve as a voice of connection, even to our local county government. And support research by quantifying the health impacts that costs of energy injustices, and support culture change that prioritizes a just economy. And then develop education and communications so that we have resources and templates for testimonies or op-eds, like the Tiny Climate Chronicles, or use national conference platforms to inspire action on energy. There's a lot more that can be done, but these are a few tangible ways that we can start getting involved.
Absolutely wonderful. I appreciate the actionable items, and I'm sure our audience does as well. There's so many great questions in the Q&A, and unfortunately, I don't think we have enough time for all of these, but I will pass these along, and if our speaker has some time to respond, she'll be glad to do so. No guarantees here, but these are such great questions, and we appreciate you sending them in. One that I'd like to send your way, if I can give you a rapid fire question. Can you share a little bit about the interaction of climate change and food access?
Sure. So there's a few touch points that climate change impacts food access. Access is already something, is a social determinant of health, right? Access to clean, affordable, safe, nutritious food. Climate change in really high heat days impacts the nutritional quality of food. And then also there's the literal access to it. So when we're having communities who lack access to personal vehicles or transportation modes often have to use public transportation, and with flooding in some flood zones, that could be a limiting factor. Having places of food deserts could also be an access issue in terms of quality food. So there's several touch points, and I would also say there's also the worker safety component, where we're looking at agricultural practices that also limit health and safety for workers.
Absolutely. So we are at time, but I have a question here that I know you have a very vested interest in. So one more rapid fire, and then, as promised, we will wrap up. How can we encourage future generations to pursue education and training in environmental health?
Oh, I love this question. Well, if you live in it, if you work in it, if you play in it, if you learn in it, if you worship in it, that's your environment. There is such a deeply rooted connection between our environment and our health. And to get folks involved in environmental health, I think it's really important to make those connections, that it is human, it impacts all of us, it impacts us in a future generation. So get involved.
I love it. Get involved, and we can be that beacon to help bring people into this profession. Thank you so much. I want to thank everyone. We appreciate all of you for being here, but I especially want to thank our esteemed speaker, Sarili Sataria Patel of the American Public Health Association. To those who submitted questions, thank you. We're coming up on the hour, so we need to disconnect, but we greatly appreciate you sending these questions in. I would like to thank all of you for taking the time to join us, and I hope you found value in this live chat today. I certainly learned a lot, was taking notes furiously the whole time. So please visit energy-neha.org to continue to follow our live chat series, and soon you'll find this recording posted there. And please share and disseminate this widely. On behalf of the National Environmental Health Association, thank you for attending COVID-19 and Climate Change Concurrent Health Emergencies.